you coming here. We really appreciate you coming by and just really spending the time to learn a little bit about what we do as mental health professionals. This is a power and control wheel. That's a side comparison of the tactics that batters use in relationships, as well as the equality wheel in which they use to form some good practices to have a healthy relationship.
I'm Dina Trevino, and before we get started, were you going to talk to the audience about ways they can ask questions?
Yes, Dr. Trevino. My name is Natalia Contreras. Thank you. I'm the program manager with the FVPP. Thank you all for joining Judge Alvarez's presentation with the parenting through domestic violence. If you have any questions throughout the speaker's presentation, please add it to the chat. And at the end of their presentation, we will go over the questions and answer part. I'm going to ask Norma Cavazos to give some instructions as well, and then we'll turn it back over to the presenters.
Hi, this is Norma Cavazos, and I am the program assistant for the Family Violence Prevention Program. So welcome everybody. We do have a pending CLE credit on this course. If I'm going to put my email address on chat, if you would like to be aware of that CLE credit when it does get approved, please send me an email. Therefore, when I do get the approval from the State Bar, I will go ahead and send you the course number or the QR code so that you can obtain your CLE credit. I am going to put my email on the chat.
Okay, if Dr. Trevino, you want to take back over?
Yes,
presentation
thank you.
is yours.
Thank you. Also, our PowerPoint presentation is available to whoever wants it afterwards. We're happy to share that. If you'll put your email address on chat, then David and Kelly and I can get that to you. And at one point, I'm going to at least be talking about some journal articles that if any of you are interested in getting, I can also send you the citations for accessing those as well. So thank you for joining us. As David said, we're going to base our presentation off of the Duluth model power and control wheel, which was one of the earliest models of domestic violence that I'm aware of that was developed. There's a number of different models of violence and power. This one is based mostly on a lot of issues of systemic power and control in different settings. And I have this one side by side here that y'all can look at that I have found useful in doing therapy. Can everyone hear me okay? Yes?
Yes,
okay.
Thank you. And if I could ask everyone to put yourselves on mute so we don't get any feedback. I know it's hard to do, but please be mindful of that and keep yourselves on mute until you're invited to ask questions. Thank you.
Thank you, Judge. So one of the things that I have found useful in doing therapy is that when people come in and they have had a history of experiencing domestic violence of the non-physical kinds of type of issues of power, coercion, intimidation, and control, is to help them look at what kind of healthy behavior they can contrast the power and control abusive model with to understand what the goal is. So when I work with people, y'all might find this useful also. If you see on the left here, we have the equality wheel. Are we sharing the screen already, David?
Yes.
Okay, we have the equality
Get back on
wheel.
this course.
I'm sorry?
Don't worry, it's people that are not muted. It's like whack-a-mole. I'm trying to mute everyone, but please continue. I'm sorry for the interruption.
Judge, whack-a-mole is power and control, okay? We have the equality wheel. If you look on the left-hand side, you'll look at how healthy relationships negotiate through conflict, engage in showing non-threatening behavior. They will talk and act so that the people that they're talking to feel safe. They show respect, as opposed to, they have trust and support. They're as opposed to using isolation or abuse or intimidation. So these are two ways that we have found it helpful to look at power and control, as opposed to goals of healthy, mutually respectful behavior. We're going to break our presentation down into three short areas. Kelly Bernstein does a lot. We all do overlapping work. We do the same kind of work, but Kelly's going to take working with children in therapy, which oftentimes includes the parents, and how to identify and be mindful of abuse in the therapy sessions she has with children. David Cantu is he does a lot of reunification therapy, which is also a form of family therapy, and how that can be identified, recognized, and pointed out in relationships in therapy. And I'm going to talk about looking for being attentive to the presence of domestic violence in doing custody evaluations. So, well, Kelly will go first.
All right. Good afternoon. I'm Kelly Bernstein, and what I'm going to be discussing today is my approach to assessing and looking at domestic violence through the therapeutic treatment concerning children. In my work, and I believe one of the goals of the court system and of all of us professionals working together hand in hand is to ultimately be child focused. What we're looking at here is the best interest of the child, no matter if it's me working as the child therapist, if it's David working on a reunification, if it's Dr. Trevino working at a child custody evaluation, we're focused on the child and in the best interest of the child. Something when working with families, children in particular, in therapy in the court system, the indicators and the resulting issues of abuse, this could include emotional abuse, mental, physical, sexual abuse, neglect. The indicators are not always clear. Often the indicators
it's a potential CLE. We don't know if we're going to play it or not for it, but it's regarding domestic violence, reunification, child custody evaluations.
An intake and those used in therapy to continually screen and aid in the therapeutic process.
No, it's from noon to 1:15.
That is often discussed between professionals when looking at the therapeutic process and the different overlapping roles, is that everyone that walks through that door is there for a reason. Every person that walks through that door has experienced a trauma, a hurt, a pain. Something has occurred. And that's why I think one of the reasons that it's so important that our roles overlap. We're all a different piece of the puzzle. And ultimately, we want to all take our pieces and put them together to get the complete picture. One of the things that I do in the intake process is I always look for a paper trail. We can look at this right now. This is good, David. This one right here. I always look for a paper trail. This might include a document of long-time litigation, sometimes police reports, emergency room reports, documents from a child's pediatrician, the school or school counselor, documents from a former counselor, documents from other professionals, counselors' notes from previous professionals that have been working on the case, psychological assessments, psychological reports that have been done before. Also, I find it's a useful technique to always meet with both of the parents whenever possible and with as many members from the household as possible as well. Let's look at what are the different accounts of behavior in the family from member to member. Do different family members describe or perceive things differently? Do members of the family, for example, the mother or the children, provide excuses or justifications for abusive, neglectful, or abnormal behaviors? A major indicator of domestic violence or abuse in the home during intake can include self-blame, amongst several other things. I would want to ask different persons if they believe that the child has witnessed domestic violence or indicators of domestic violence. While we as adults may believe that the child has not witnessed domestic violence or has reported they have not witnessed domestic violence, children pick up on the indicators. Children are very intuitive to small environmental factors, and children will express this often in more subtle ways and behavior. We're looking at our abuse of children wheel now, and I would like to just take a moment to look at some of the different indicators and some of the potential impacts. First, some of the indicators, let's talk about physical abuse, unexplained bruises, multiple injuries in different stages, human bite marks, unexplained injuries, things that may be chronic. Physical neglect can include hunger. Let's look at hygiene habits. Are physical problems, medical needs being attended to? Lack of supervision, is the child looked after? Issues of abandonment, sexual abuse. This is something that is a little more sensitive in domestic violence, but often we have to look for sexually transmitted diseases that may include cooperation with medical professionals, difficulty walking or sitting, bruises in the private area of the child, bruising, bleeding, and then emotional abuse oftentimes can be expressed through somatic indicators, frequent stomach aches. For example, a child might not tell you that they're nervous or they're anxious, but they might tell you that their tummy hurts. This can be an indicator of stress and anxiety in the child. Children who have experienced emotional abuse may also display speech disorders. They may lag in physical development, such as failure to thrive, and may have medical diagnoses of learning problems, cognitive issues.
Is that better? I got notice that the sound might be too low. Is that better for everybody?
Much better, thank you.
Okay. Now let's look at some of our potential impacts at different ages. Let's look at preschoolers or 0 to 5. Some of the key aspects of development might be learning how to properly express emotions. So possible impact of domestic violence might be difficulty in properly expressing emotions, such as expressing anger or aggression when difficulties or conflicts. Children in this age category think in a very egocentric way, and they may often attribute the violence or the conflict in the home to something that they have done or have not done, a lot of self-blame. We're also wanting to make sure to take a look at the formation of ideas surrounding gender roles and social messages. Oftentimes when we look at domestic violence, we may see expressions that gender roles are associated with violence or victimization. And we want to, of course, always take into account, let's look at the child and their, what is their level of independence? Are they able to do for themselves independently and properly? Can they dress themselves? Can they properly groom themselves? Can they do basic tasks for themselves? A lot of time, domestic violence, we may see that there is no independence, maybe due to fear, maybe due to anxiety, are not being allowed to do for themselves. When we look at school-age children, our next category here, 6 to 11 years of age, we're looking more developmentally, increased awareness of their self and others. We want to look at their reactions to violence at home and how they impact others, complexity of thinking. What are their rationalization processes? How do they justify things? How do they justify violence? Academic and social success at school is always a major indicator. How is this child performing socially and academically? And identification of self, including gender roles and the perception of intimate partner violence. Next, we're going to look at the category of adolescents, and there is, I believe, a third wheel up here, second or third wheel, that is going to focus more on that later. But adolescents, part of development, they're going to want to look at their self-anatomy from the family. Are they respectful? Have they learned how to properly negotiate? Physical changes in puberty, and how they react to those, and incorporate those into their daily life and family. We want to look at their peer groups and how they fit in with their peer groups. Oftentimes when there is violence at home, we see that peer groups may include groups that may include violence, bullying at school, maladaptive mechanisms such as drug use, alcohol use, runaways. Okay. If we could go ahead and go to the next wheel, David, I think that we wanted to. Okay, that was kind of part of that. How violence affects children. Domestic abuse will. And we're looking at some of the different things, some of the different domestic violence effects that may happen in the home. Intimidation, isolation, emotional abuse, physical and mental effects, sexual abuse, using the children, threats, sexual stereotyping. All of these things can have a negative effect on the child, and all of these different things are just a few select of different things that we notice in domestic violence when working with children.
And that we should be on the lookout for also when we're evaluating children for the courts and for therapy.
Yes. Therapy with children provides an environment. They need to feel safe. They need to be able to experience their feelings without restriction. Oftentimes play is involved. This can allow children to distance themselves from abusive experiences that can be painful, and be able to share that directly with a therapist, with a professional. I believe when looking at the needs of children, it's important for us to look at the phenomenological or phenomena, look at how the impact has led to the child believing or behaving versus what we might expect a child who has not experienced domestic violence or abuse to react or to behave to the same incident. We also take a look at the family's level of dysfunction, environmental stability, the age of the child, and the child's relationship to the offender, which can so greatly vary and affect our work. In therapy, I often allow children to play out their difficulties. Children are more prone to play than talk. This allows them to physically, verbally, emotionally act out some of the difficulties at home. I do a lot of play therapy or time on the carpet in my office, and I utilize different techniques, which may include dolls, doll houses, building blocks, different characters, and storytelling games. Let's go to the adolescent wheel. I found this to be very interesting, the team power and control wheel. And the reason that this is interesting is because even though we're in a therapy with children category here, we all know that from young children to the age of adolescence, they vary so greatly. And I think that it is important to discuss children who witness domestic violence are more likely to exhibit behavioral, physical, and mental health problems. This includes depression and anxiety. Children who witness or experience domestic violence are also more likely to attempt suicide, use drugs, abuse alcohol, run away from home, and engage in teenage promiscuity and become sexually active at much younger ages. They may experience strong ambivalence towards the violent parent. They may lose respect for the victimized parent. And this is often something that can lead to the gender stereotyping that we talked about a little earlier. It often leads to aggressive behavior and quite often to decreased academic performance. Also, something interesting is that the teen category is the most difficult category to work with in reunification, particularly teenage girls in reunification and family therapy.
Which leads us right into David's working in reunification.
So good morning. So I'm going to talk about reunification and how that affects the family dynamics. So in the first one, what is our target population? You know, for family therapy, it's target population is where there's an estranged parent. And that's where the parent-child relationship is really caused by environmental stressors or interferences such as military deployment, or they move to a job relocation, or homelessness. All these things, a remarriage, a blended family. So when that's environmental, that there's really nothing that people can do because they still have to live their lives. Let's bring the family back together. Sometimes it's imprisonment. And so when they come back together and we say, okay, this is that target population, what is it that their strengths are, and what is it that we need to work with to reestablish that relationship. Another target population is post-separation and families and divorced families. This is really difficult because when families get divorced, that's one of the most stressful times in anybody's life. And the children feed off of that stress from their parents, and it's very, very difficult. And many times it creates a conflict loyalty between parents. The next one is blended families. Blended families is the influence of the ex-husband or ex-wife having an influence on these two people with children. They come together, and it's difficult enough to have this blended family have a healthy family dynamic, but yet when you get exes involved or stepchildren or even half children, that makes that all the more difficult to reunify the family, because there's always some different type of dynamic that's coming up. Post-deployment with military families, being deployed is not a choice. It's when the Army calls you or the military calls you, you go. And depending on where, if you're at Fort Bragg, they'll just tell you, listen, you need to be here in 6 hours or 4 hours and ready for deployment. And there's no time for goodbyes. There's no time for closure. Or when you're being deployed and you're going to be gone for a year, and your son or daughter is there at the airport and having to say goodbye, and how that really affects a child, feelings of separation anxiety or abandonment. Therefore, when they come back, there's, on one hand, there's this, oh my gosh, this is my parent, they're back, I'm real happy to see them. But then there's anger because they felt, why did you leave me? And the resistant child in the parent relationship, this family system is really what comes across our desk most of the time, is that there's a resistant child either through conflict loyalty between parents, or one parent is trying to erase the relationship with the other parent. And so we really have to focus on what is it, target population are we getting to address?
David, this is the part that I find interesting a lot of times, where in the family court, we really get to point out that parental alienation is also a form of domestic violence, and highlight some of the techniques used in parental alienation and the effects that it can have.
Definitely it's something that we all have on our radar. I know there's some different points of view on whether, since it's not in the DSM-5, that it's not an actual diagnosis, but however, the symptoms that a child goes through are not in a book. They're not, that they don't need to be diagnosed because we can see it for ourselves, a change in their behavior and attitude. So when we're doing reunification, what is the chance for success? And so there's different levels that I have to keep in mind, and they all involve different types of interventions. The easiest one, if all parties are motivated to reunify, but there's just been a separation. And so at that point, it's really about just getting the parties together and answering their questions and getting an understanding of, what caused the separation, that whether it was intentional or unintentional. But at this point, we just move on and we create new memories to override the old memories of separation. The next one is the child and parent are motivated to reunify, but the primary parent is not motivated to reunify with the child with the unfavored parent. And that gets more difficult because you'll see that most in passive aggressive behaviors. And those passive aggressive behaviors are often seen in what you've previously seen on the power and control wheel. So a lot of people say, well, this one little thing, this one little passive aggressive behavior really isn't a big deal. However, when you look at the family dynamic and look at it from a holistic point of view, there's a whole lot of really small passive aggressive behaviors that are going on from the primary parent. And it's a mental health provider that's needed to, the mental health providers that's needed to really be able to identify, is this an incident that is just needs to be addressed briefly, or is this actually, the holistic family dynamic that really needs to be paid attention to? The next one is the child is not interested to reunify with the unfavored parent. This can be for many different reasons. They could have, in teenagers, they have a lot of activities at school, and having to go visit the first, third, and fifth weekend is really difficult because now they're missing out on some relationships with friends, things that they want to do with their parent, when the unfavored parent is really seen as an obstacle to their life, not necessarily as the importance of being in their relationship. The most difficult one is a child-parent relationship has a family history of domestic violence and/or sexual abuse. And I can't tell you the number of times that I've seen families in my office, and I'll ask them, is there a history of domestic violence? And they'll say, oh no, there's no domestic violence. And then I'll ask them, just in one case, I've asked them, well, who handles the finances? Who is it that really has access to how much the child is getting? Whether they're trying to buy their love, or is there where a sense of economic abuse where one parent is really just doing everything they can to restrict the finances of the other parent? Because in the divorce, you've seen it many times where they either hide their finances, or the primary parent will tell the unfavored parent, or tell the child about the unfavored parent, saying, see, they don't even want to pay for half of your cheerleading.
Exactly.
And so they should have no knowledge about who's paying the bills, but they use that often as a technique of domestic violence.
So, what?
When addressing domestic violence within the reunification intervention models. We have many different intervention models that we have at our disposal, depending on each individual case. You know, we generalize to the populations that were discussed earlier that we use these intervention models. However, we have to look at this each family dynamic to be client-centered, such as, okay, we look at the power and control wheel, we identify what they're using and how the child has experienced the domestic violence, but then we have to really center it in on them and center it in on what is this child going through that's causing the relationship difficulty with the unfavored parent. Or there's another model out there, it's the strength-based therapy. It's from Emerge. You know, that's where it's more of an individual counseling, that where you talk to the battered parent or the unfavored parent because they did commit domestic violence, and you really identify, you know, what is it that you're good at that can help you prevent these passive aggressive behaviors, these comments, these domestic violence, being aggressive, intimidation, and so forth. You know, many times at the beginning in my intakes for reunification, I see the parents first by themselves for 1 hour to see what their concerns are and see where do they see the barriers to treatment are. Then I see the child by themselves to really see, okay, what are the child's concerns? And many times I find it necessary to say, okay, the parent and the child really need to do their individual counseling first, so that way they're ready to cope with the difficulties of reunification, because it's really about their family dynamic and what they've been doing in the past that hasn't worked for them, but yet they still want to continue doing it. We may also refer to different outsources that can help in this, such as co-parenting programs, such as group co-parenting or individual co-parenting, or where they both need to go to co-parenting sessions together. Or we needs to be referred to a parent facilitator that can really see whether the one or the other or both parents are being passive aggressive in that behavior and just being resistant to having to do anything with the other parent, which is affecting the child-parent relationship. When we talk about the stages of treatment, so this is a protocol that I use, or a treatment plan that I use to really say, how do we move forward in this? And I touched a little bit on it earlier, where this is just a guideline. The treatment plan really has to be client-centered as it's moving along. And it's not uncommon to move forward, and then you may have to take 2 steps back in order to really be able to make this reunification work. So the first one, you meet with the parents separately, meet with the child, and then you have, at that point, you have to identify who should attend the reunification, because domestic violence may be involved. And the last thing we want to do is re-victimize the child if we don't understand the dynamics of what's going on. If the next one is, we empower the child to advocate for himself or herself to the non-favored parent and the favored parent. That's very important, because realize the child doesn't have a voice. They may be angry and they may be toward the unfavored parent and they may be very upset, but it's most of the times it's that they haven't been heard and they're angry for not being heard, and they don't know how to, that loyalty conflict gets in the way and really says, well, I can't be mad at the primary parent because that's who I live with. So now I have to be mad at the only person who's left to take it out on is the unfavored parent. So you empower the child to advocate for themselves. The next one is facilitate tasks to create new memories, to overwrite old bad memories. So that's in addition to just, talking as to what's the schema behind where these original feelings derived from to the unfavored parent, but you also have to work on creating new memories, such as going to the park, going for a walk, going to an escape house, just time with just them and without the influences of anybody else. Because what they need is quality time together. And really just to say, the only boundary that you have is you can't talk about anything serious while you're doing this. It's once the reunification has started, some type of stair-step approach needs to be in place to where they can see progress. The unfavored parent can see that they're getting more time, and the child can start having more and more memories. This is difficult when you throw in domestic violence, because now there's a risk factor that also has to be included. And those risk factors may be very, very subtle, but every therapist has to be aware of them, such as, is there a stuffed animal that's used that every time that stuffed animal comes out, they know they were going to get in trouble or hit or, intimidated. And so that's the reason why I do those intakes individually, because where if most people may not even realize, oh, they just bought them a stuffed animal. No, it's a signal. And then once that stair-step approach becomes routine in accordance with court orders, at that point, we have to look at discharge. One of the biggest concerns that parents have is, well, why are you discharging them? They don't have a good relationship. A relationship is not going to be perfect. It's difficult that with without there being divorce or there's all kinds of dynamics. The real goal here is a relationship good enough for them to work on it on themselves. Are they okay to just spend time to do visitation, and then they need to work on it? Because a therapist is not to provide guidance to say, this is what you need to do to go to the next step for the rest of their life. We're just to say, here goes the tools, this works, and now go out and do it with your own child. And then you discharge. Unsuccessful reunification of the child-parent relationship is really about, a really good example is a post-separation power and control wheel. That has many, many indicators of what you can really seriously look at. There's passive aggressive behavior towards the unfair parent. There's parent alienation, parental alienation that goes on where they try to erase the memory, or they try to blame even simple tasks that should be reasonable in a child-parent relationship to now all of a sudden it's unforgivable. I've seen parents go therapist shopping where they switch from therapist to therapist until they find one that will collude with them. And the last one is the attorneys that the parents choose. If they find an attorney that's pro-family, that's going to be a lot less conflict involved in that divorce. And that less conflict really trickles down to the children and how they're handling the divorce or the separation. Or is the attorney pro-client? In those cases, conflict is just a part of being an attorney, and it really focuses less on the family dynamics once the attorneys are no longer in the picture. Family reunification therapy using court to perpetuate domestic violence, such as some examples that I see are they plan the dates in which they actually call to set up sessions. They're inconsistent with meeting appointments of because they feel a stomach ache, or they're in school, or they have homework, or no. When you come to therapy, we identify it as being medically it's a medical necessity, and we can show you why. So it is not. There's no difference between somebody with mental health and somebody who broke their arm. They're both medically necessary. If they sometimes they perpetuate domestic violence by intimidation. I can tell you there's there's attorneys and the parents who have called to try to intimidate me. I've seen it where the possessory parent intimidates the child to intimidate the unfavored parent. I've seen it, the verbal context in which counseling has occurred, or the unfavored parent has said a statement and it's taken out of context. It's sensationalized. The next one is it within the therapist or mental health provider's scope of practice? Not just anybody can do not any mental health providers can just treat autism because they're not familiar with it. It's a specialty. So if you have a child with autism it needs reunification, it's not just as simple as just following the plain old plans. It's a matter of really, paying attention to what is your target population. Is there other mental health needs that need to be considered?
2 questions in the chat, David.
Sure.
Judge, can you tell us what they are? I can't see them.
Yes, absolutely. I didn't know if you wanted to take the questions now or at the end of the presentation. We're at 12:45.
Now it's fine.
Okay. The first question is, are there specific qualifications for a family reunification therapist versus a family therapist?
So they have the qualifications. However, you really, what we're talking about is it in their scope of practice? Have they gone to domestic violence trainings? Have they gone to reunification continuing education hours to really get specialized this? Have they attended seminars? What is it that they've done to really be able to identify these? Myself, I've been working with domestic violence since 2006 and working with batterers and victims of domestic violence. And I can tell you, I've probably treated over 1,000 patients with domestic violence cases. So all this being said, it really has to be, is this in your scope of practice? Because the risk here is that if you're a mental health provider practicing outside of your scope of practice, you can actually begin to collude with the batterer and make things definitely a lot worse.
Thank you. And let me go ahead and let you know the second question. It may tie in with that last point. The question is, are we assuming that the primary parent, I believe it's in the context of parental alienation, that the primary parent is the victim? Can we talk about the specific scenarios of what the so-called quote unquote alienation means when done by the alleged abuser and or the alleged victim? Are they different?
I'm actually not sure we have time for that. That's a super important question, and maybe, Judge, that's something we can have, someone can have their own hour devoted to that, because that's important. But we're not prepared to deal with that in this 15 minutes that are left.
Okay, that's the question out there, and we did do a lunch and learn at the 2019. So it is a topic that is worth revisiting, and we'll plan on that. We're at 12:48, so I'm going to turn the presentation time back over to y'all.
So last one, we're talking about treatment plan. Any mental health provider should be able to provide measurable outcomes to say, this is what this is my treatment plan, and this is how it's going to be accomplished with outcomes up to 70% of completed in order to discharge, or whatever that may be. But a treatment plan will be able to identify those. The next one is domestic violence can also take place in when they're talking on the phone or face-to-face or Zoom communication to intimidate the child. In Zoom, I've seen it where they're on the other side of the camera giving instructions, and I can tell because I'm seeing the child's eyes move up and down. I've seen it where I was on a Zoom session, but they didn't know I was on the Zoom session as a therapist, and the parent with domestic violence was writing down on a cardboard intimidating remarks. And so there were threats going there. The last one here is Our Family Wizard and AppClose that are really good tools to be able to identify what type of passive aggressive behaviors or aggressive behaviors that the parents are having with each other to continue the domestic violence. Here are some of the sightings that Dr. Trevino had mentioned earlier.
I haven't mentioned anything yet. I'm gonna go into that.
Oh, okay.
now.
Right.
Can I have the? Thank you. It's my turn now. I'm Dina Trevino, and it's really interesting. We're sitting here in a little dark room. We see the screen, but we can't see each other. I mean, we can't see anybody else. So we're sort of just talking to each other. Kind of fun. So before I get started on what I want to talk about, where's the camera looking? Right there?
Yep.
Okay, and the microphone's here. So before I get started on what I'm going to talk about, I do want to address really quickly the issue about the difference between family therapy and reunification therapy. David's right in that the training essentially is the family therapist has the skills and the knowledge necessary to be able to do reunification therapy with some issues that have to be considered very carefully. The family therapist has to have some knowledge that we are in litigation, and that the issues that come into play because they're involved in court bring additional problems to doing family therapy. There are important reasons that people in reunification therapy may buy into doing reunification or may not, and the family therapist needs to be aware of that. Like David said, the family therapist needs to have specialized additional training, even though they already probably do have training in domestic violence. They need to have additional knowledge of domestic violence. They need to have additional information about the ties that and the conflict that the children of divorce find themselves in, the ways in which they choose to manage the anxiety that goes along with being in a high conflict family. And a lot of that becomes alienation sometimes. So we can't just find a family therapist and say, great, we want you to do reunification. They have to have some particular knowledge about the kinds of different confounding factors that can come into play and limit the ability of a family therapist to be successful. I hope that helps clarify a little bit. I want to talk about, and again, everything we have is available. If y'all give us your email, I have links to the articles that I'm going to be talking about. We can send you as just some additional information, our PowerPoint. But I'm going to talk about some scholarly articles that address domestic violence issues in the context of child custody battles in court. Time permitting, I want to talk a little bit about a problem, which is at times there's a strategic advantage in contested cases for custody for one party to be viewed as a victim or one party to be viewed as a perpetrator of domestic violence, and the importance for us as child custody evaluators and as therapists of different sorts to be able to gather objective data, look at risk factors, and then make useful recommendations to the court for the ultimate decision-making. In the several articles, I've got 5 or 6 articles, but I'm really just going to go over 3. In the several articles that I want to discuss with you, there's an agreement in the 3 that there's a need for child custody evaluators to have a systematic and rational method to ascertain the credibility of the allegations of domestic violence when they occur, and to routinely assess for the possibility of unrecognized or undisclosed issues of domestic violence in families who are going through divorce. And the likelihood of this being that's something that one particular family needs to be addressed. When we're talking about domestic violence and battering in families going through divorce, I have some statistics on how frequent they are. They're much more frequent than not. And it's almost a given that there's going to be some allegations of some sort of domestic violence by one or another party, whether that be the person who has the child most often or the one that doesn't. So what I'm saying is that we need to not just check to see if domestic violence has occurred by me sitting in an interview and saying, so has there been any history of domestic violence in your family? And the answer is, well, no, we've always been very loving together. But rather it's important for us to take an active approach to ask specific and detailed questions and to be alert throughout the evaluation for evidence of risk factors, such as David and Kelly have been talking about, and then to follow through at looking at those in detail. A caution here, though, is that this is an area in which overreaching by inexperienced or underskilled or not, or therapists, maybe therapists who aren't familiar with the court system, can be common. We've all run into therapists who have been more hurtful than helpful to our cases. It's important to be cautious in our assessment as therapists when we look for information during the evaluation. We need to be able to look for something that is true to the sufficiency of the data on this issue, just as we would with any other issue. To have a, to have a healthy skepticism is always important in doing custody evaluations. One other real quick point is that there's been some trainings, programs recently where they say psychological testing is not useful in identifying battering or domestic violence. Well, I want to say that that's true. Psychological testing in and of itself is not helpful in saying this is a batterer. This test profile is one of a batterer. However, the usefulness of interviews, the usefulness of the clinical interviews, psychological testing, is to look at the risk factors, because psychological testing and good clinical interviews can bring out information about risk factors, things like impulsivity, things like history of getting into arguments or causing conflict, history of the presence of drugs or alcohol in the family. So there are risk factors that increase the likelihood that there's a possibility that there may be some domestic violence. And that can be very helpful. So the first article that can you go to these are the ones I'm going to talk about. First, I'm going to talk about Dr. William Austin, Bill Austin's Assessing Credibility in Allegations of Marital Violence in the High Conflict Child Custody Case. I can get you this article if you want it. You have to just email me. It's an old article, but it's classic. Dr. Austin is the person who has given us risk factors and move away cases also that's been very helpful. So he presented in this article a 6-factor model as a guide to custody evaluators to address the issue of credibility of previously undisclosed allegations of marital violence that then become disclosed during the CCE process. So these are allegations that had not been talked about during the marriage. All of a sudden now, someone's saying that she's thrown things at me, she threatened to shoot me, he did this, whatever. So it's an old article, but remember, the research that looks at domestic violence and the different permutations in which it can be found was pretty sparse before the year of 2000. So we're going to look at what he's in the next article. We're going to look at what he's provided us in terms of risk assessment. So some people have said, according to this article in 2000, that if it hasn't been legally established that it's domestic violence, if it's not adjudicated domestic violence, then it's not relevant as during an investigation, doing a custody evaluation. But I think that we as a group are past that. I think we recognize now that there's more nuances to domestic violence, especially with the things that Kelly was showing us in some of these that can continue post-divorce and separation. So the 6-factor test for credibility of domestic violence as presented by Dr. Austin. One is, wait a second, where is that? That is not. No, the one before. Yeah, we're still on.
Oh, I'm sorry.
Here. We're on objective verification. So objective verification as opposed to hearsay. If you can see text messages, we've got a lot of help as custody evaluators in the form of social media, text messages, taped phone calls that people have saved over the years, documentation by family members, therapists in the past. That's what I'm talking about, objective verification. He's also talking about another factor is that we're supposed to need to look at to see about domestic violence rather than just ask, has there been any arrests for domestic violence in your family? We look at pattern of abuse complaints. Did the abuse complaints just start when they started to have problems and start threatening each other with divorce, or have these been going on over the years? Can you get corroboration by others who are credible? I don't know, mothers can be real helpful, but they can also just believe everything that their kids tell them. We have to be careful who's telling us that they know that it happened and how they can prove that to us. We have to have a healthy skepticism. We need to look for the absence of disconfirming verbal reports, that we don't hear anybody who says, no, that never happened. We never saw anything like that. We want to by credible parties. So we need to look at the psychological profile also for risk factors. That's not the most important thing, but it's a thing to look at. And we need to look at past history of abusive behavior with others by the alleged perpetrator, male or female. The last factor there is to look at the psychological status of the alleged victimized spouse partner to find out what their history has been, and whether there are factors in there that could lead to concerns that may minimize the credibility of that person. Some of those are mental health factors, some of those are drug abuse and alcohol abuse factors. So look at number 5 and 6 again. Those are the ones that are talking about psychological status. That's not, again, like I said, it's not telling you that psychological testing can tell you whether or not something happened. It is looking at risk factors based on the whole of the testing. The next one, David, thanks. The next article is also by William Alston. He's prolific. He writes all the time. This is an article, Partner Violence and Risk Assessment in Child Custody Evaluations through the Family Court Review in October of 2001. Also old, but it's still, I think, quite pertinent. This is, what time is it? Okay, I'm in the second article, this also old. He looks at theoretical typologies of partner violence as anything that is suitable to the predictive tasks of the evaluator using a risk assessment approach. Similar to what he did for relocation and move away cases, he calls for a comprehensive framework for examining the problem of crafting arrangements appropriate for all subtypes of partner violence, especially when a child is exposed. He talks about how important it is to look at the risk factors, but you also need to look at the protective factors that we're not going into here. That would be a good topic for another hour discussion that can predict developmental outcomes in children. For example, the temporal dimension of the abuse or violence, whether it's reactive to the separation, if it's a single incident, if it's reciprocal, if it's bidirectional, or if it's an enduring, chronic, consistent pattern of violence. The sex of the perpetrator and the causal direction of the violence. This doesn't address whether it's credible or not credible, but understanding the dynamics of if it's a male instigator, female instigator, if it's more bidirectional, mutually instigated, or mostly male bidirectional instigator. Those are important things to look at rather than the number of instances of domestic violence. How severe it is. That doesn't mean that pushing or slapping is less severe. It doesn't mean that it's less important, but it does help you look at the typology and what kind of efforts you need to go through to protect the child and the family and help them move forward. Whether it's mild, like pushing, throwing, I said thorough, but it's throwing something, shoving. Whether it's moderate, which is more kicking, biting, slapping. If it's severe, hospitalization, shooting, threatening with a gun. The type of aggression on the next page is, on the next slide, is whether it's verbal or physical, is important to be aware of when you look at how to set up protective factors and how to make recommendations about moving forward. The presence of major risk factors are the presence or absence of alcohol, substance abuse, ongoing mental disorder, just a plain mental disorder, bipolar disorder, personality disorder, or a history of violence. And the other one is whether children have been exposed to it and party to it or not exposed to it. So this presents a system that's useful because it combines research-based actuarial factors with clinical skill into what you call a guided clinical approach in the violence risk assessment literature. Judge, how are we doing for time? I have one article, I can stop.
You have about 8 minutes. I was going to give you a 5-minute warning, but you've got about 8 minutes. And if you want
Okay,
the 8 minutes,
yes.
folks, okay, folks, please.
So the one right before that,
I'm sorry. Folks, please put your questions in the chat. We'll grab them. They will be addressed at another session. And the presenters can go ahead and continue the presentation until 15. Thank you.
Okay, so here, the next article is James Bowe. That's not the one I'm talking about yet, but I don't have the slide for that. I'm looking at James Bowe. He's assessing guidelines of assessing allegations of domestic violence and child custody evaluations. It's a 2003 article that's also good that I can get you. Y'all might find it useful if you're looking over custody evaluations that have been done. I find that custody evaluators typically are trained they have the experience, they have the knowledge. They don't always list those kinds of factors in their reports. So it's important to find out whether that was something that was looked at and addressed or not, if it's not written in there. But James Bowes' article, this is interesting. It looks at important factors for child custody evaluators to recognize, address, and present an adequate review of the risk factors in child custody evaluations. Evaluator needs to have a adequate training in domestic violence, ongoing continuation in the field, ability to review documents and collateral context. Those are real important when you're looking for domestic violence. Don't overvalue the use of psychological testing when you're looking for domestic violence. It's helpful, but it's not the most important thing. And there are some specific structured interviews and questionnaires that don't seem to be used much in our area. They tend to be short, they tend to be face valid, and they tend not to give much information, but there are those available somewhere, and that some locations do like to use them. Then the last thing I wanted to point to for people, AFCC, Association for Familial and Conciliatory Courts. I would imagine that most of you are familiar with them. Most of you probably have gone to AFCC trainings, but they have guidelines available that are aspirational. They're free if you go to their website. I think it's afcc.org.net, I think. And so they put out guidelines for examining intimate partner violence in child custody evaluations. Again, they have 3 main points. Use a systematic and rational method to ascertain credibility. Second, incorporate a broad view of intimate partner violence that includes physical, sexual, economical, psychological, and coercive, controlling, aggressive behaviors, which is why I like the Duluth model. I don't pretend that all domestic violence is because of systematic power and control differentials in our society, but I do believe that it very succinctly lays out examples that our clients will be able to recognize when we are looking for domestic violence. And thirdly, recognize that these behaviors can vary in terms of frequency, recency, severity, directionality, pattern, intention, circumstance, and consequence. And all of those factors come into play when we are looking at how to, where to place the domestic violence in terms of the weight that we take in making recommendations in custody evaluations. Thank you. These are the references, additional references that I found useful. But again, anything y'all want, let us know, give us your email.
All right, thank you all very much. I know I'm not alone in expressing my appreciation to Kelly Bernstein, David Cantu, and Dr. Dina Trevino. Thank you all. We are just up at 1:12 with just a few minutes. Please put your questions in the chat and we will try to capture those. We're going to capture all of those and see if we can start planning for trainings around them. Would y'all like to take a question too? We may be too rushed and I'm presiding court, so I do need to head over. But how about we do that? Just put your questions in the chat, please. If you'd like to continue and join the conversation, we do have a standing Thursday work group session meeting discussing parenting through and after domestic violence. That's part of the Gen Fellowship supported by the NCJ, FCJ. And I can't say thank you enough. If you're interested in joining the Thursday work group, that meeting ID on Zoom is 976-6723-3457. I see a few questions in the chat. We'll give a few minutes or a couple of minutes to populate the chat with additional questions. Dr. Trevino's email address has also been included in the chat.
And we would like, if, excuse me, Judge, we'd also like if y'all can give us information as a group, not just the three of us, but what was helpful, what was not helpful, what you would have liked to have seen that we didn't give you, so that we can, together with the group that we're presenting this from, come up with more focused trainings in the future. Because I think, Judge, is that right? We're going to be having several of them.
Yes, we do. We've got a training schedule that's going to take us through, I think as it stands now, through next February. So please be on the lookout for those monthly training opportunities. And we have the support of the FVPP, the Family Violence Prevention Program, to get the credits, both the CLE and the CEU. And we will be sending out an evaluation. That's a great idea. And so thank you all for being here. I know we have a lot of our community activists, a lot of our professionals, a lot of our public officials, our judges. I saw Chief McManus here, law enforcement. Thank you all very much for your interest and your work in addressing this problem in our community in a more effective and efficient and informed way. That brings us to 1:15. So thank you to our presenters. Thank you to our attendees. The session is now completed. Thank you.
Thank you, Judge.
Thank you.